Obstructive sleep apnea is a very common disorder. What happens with obstructive sleep apnea is that when people are sleeping, the airway will essentially collapse, the soft tissue will collapse, and people stop breathing against that obstruction. It doesn't really wake people up, so they don't always know what's happening, but at the same time, it prevents good restful sleep. And so people wake up often in a fog, have trouble with memory and focus and concentration, and also it can cause tiredness and fatigue in the daytime and headaches in the morning. As we learn more about sleep apnea, we're also learning about the significant medical comorbidities that can be associated with sleep apnea. We understand now that it can lead to more vascular disease, can result in more risk of heart attack and stroke, high blood pressure, cardiac arrhythmias. So it really ties in with a lot of bodily functions in a negative way. When we're concerned about sleep apnea, we have initial consultation with people and we evaluate the airway, look for areas where the airway may collapse. Sometimes there's anatomic issues we have to deal with. And then usually we order a sleep study. Now, if people do have significant sleep apnea, we'll talk about treatment options. There's kind of a continuum of treatment options for people who have like really mild sleep apnea where it's not too concerning. Sometimes we can do things like oral appliances and positional sleeping. Weight loss is always a good option for some patients. If the sleep apnea is more moderate to severe, that's where we start to see some of the concerns with medical comorbidities, and so we're more aggressive about treating that. Usually first-line therapy would be a positive pressure machine. That would be like your typical CPAP machine. There's other positive pressure machines as well. But those machines, essentially, they provide a pneumatic splint to the airway so it can't collapse, which requires positive pressure delivered through a mask. And they are very helpful. And for people who can tolerate them, they provide a good result. They can really improve a person's health. And so those are usually first-line therapy for people. We often see problems with positive pressure machines, and so we follow people closely to make sure they can tolerate it well. Now, if people really struggle with that, then sometimes we'll look into other surgical options. One thing we're really excited about now is that we can offer upper airway stimulation. That therapy essentially is a surgical implant where we place an implant into the body on the right side. And it includes a little electrode that stimulates the hypoglossal nerve up in the neck. And then there's a battery that kind of runs it on the right chest wall. And essentially at nighttime, people will turn it on with a remote control and it'll start to stimulate their tongue muscle while they're sleeping. That essentially keeps the airway open so that the tongue does not collapse and obstruct the airway, and it relieves that obstruction from obstructive sleep apnea. We're seeing excellent results. We're seeing on average a 90% reduction in the apnea-hypopnea index, which is the number of times per hour that a person stops breathing with their sleep apnea. And if we can reduce that by 90%, we're bringing people down into the very mild to normal range. And that's a significant improvement. So people will find that their symptoms are resolving, they have better energy, better focus and memory, less headaches in the morning. And it's good for the heart and lungs too, so we get excited about that. We're seeing 94% patient satisfaction. So most people are really happy with the improvement in their symptoms.